Hi, today we're going to talk about, do statins cause peripheral neuropathy? Tends to be a little bit of a controversial subject. I think we're going to help to clear that up with some statistics to back up what our conclusions are going to be. I'm Dr. Martin Rutherford. I am a functional medicine practitioner and chiropractor.
Dr. Randall Gates, board certified chiropractic neurologist, as well as being a chiropractor.
And for those of you who haven't watched us, years ago, I got pretty sick. Make a long story short, I had a functional neurologist and a functional medicine doctor who both taught me the ways to get better. And as I got better, I decided that that was the direction of the clinic, that was the way that the clinic should go. Oh my goodness. And now you all know that I listen to ESPN. And so that is the D. And so we put this clinic together, putting together functional neurology with functional medicine to cover all aspects of physiology and chronic pain. And not coincidentally, we have developed a chronic pain practice that treats dizziness, vertigo, balance, anybody who's watched us, you know, we do lots of bowel problems. We do restless leg syndrome, chronic fatigue, fibromyalgia, if I haven't already said that. But a large part of what our patient population, maybe a third, 30%, 35, I don't know, depending on the month, maybe 40%, is peripheral neuropathy patients. Pain, numbness, tingling, burning in your legs, feet, sometimes into your fingertips and your hands. And Dr. Gates is evolving a book right now for the lay public on peripheral neuropathy. Happens to be on this chapter in the book, so it's going to be very thorough today. But we've had this controversy for a long time, and there is the all statins bad group, and there is the statins very good group. I've read studies on statin and heart disease, in which the study says that it's like 35% effective. Yet in further investigation, that meant somehow that like 3 people out of 100 did better. So I'm just saying it's a controversial area. And it is the largest selling drug in the world. And so it is a profit maker. Many people certainly believe that it is maybe pushed hard by the pharmaceutical companies. And we'll probably answer a lot of those, but we're going to really stick probably 95% to statin drugs and peripheral neuropathy, because that's really what we do. It can be a significant part of our treatment. We take extensive histories. Peripheral neuropathy use in the history is significant, particularly if it correlates with the neurological findings of the type of peripheral neuropathy that would be caused by a statin drug. So let's go on to statin drugs. Do they cause peripheral neuropathy? Basic summary. The medical model says cholesterol bad, statins good. We'll start off with the somewhat maybe controversial part of it. And I'll let you go. I mean,
Okay.
I think I talk about this about 5 times a week, but I'll let you go since you've done all the studying on this. This last month or so, whatever.
Doctors of all disciplines going through biochemistry learn the pathways of cholesterol and how cholesterol is quote unquote bad, because when cholesterol is elevated, if there's inflammation in the system, then cholesterol can deposit into arteries, and those arteries can become clogged, and then those clogged arteries can affect the heart, they can affect the brain, they can affect vascular supply to the lower extremities, so on and so forth. I think most people, even out there in the general lay public, have some basic understanding of this, you know, having loved ones with vascular disease, strokes, or heart disease, which are some of the biggest causes of death and morbidity in our country. So with that, the general premise with cholesterol is that we need to test cholesterol and we need to lower cholesterol. And that's the medical model. And the way they do that is through these statin medications. And then these statin medications have been changed slightly through chemical bonds, such that we have many different statin derivatives, with newer ones claiming to be more effective. And we're not going to get into the contentious aspects of that debate. But that is the general premise for why so many of you are taking statins. And even, gosh, was it a year or two ago that some of the main policymakers in medicine came out saying that we didn't even want to test cholesterol anymore, which is everybody needs to be on a statin, basically.
They just said that, I just said 2 weeks ago, there was something on, I think it was ABC News. It was on their website, so I assume it was maybe on Good Morning America. But they said that now they believe that everybody over the age of 75 should be on statin drugs. And then there was the person who was arguing that, saying, yeah, but statistics show that people who have high cholesterol over 75 are healthier. And that's another whole topic, okay? But understand that cholesterol, okay, the controversy that is cholesterol is like, what is it, like 40% of our brain?
It's a significant percentage.
Significant percentage of our brain is cholesterol.
Number.
Your liver makes cholesterol. Doesn't cholesterol, these statin meds, some of them work by interfering with the production of cholesterol in your liver. Well, your liver makes cholesterol for a reason. Your brain needs it. Your cell walls need it. The walls that keep things out and let things through and have little chemical pathways that go through there. Basically, those cell walls start to go and we would like implode. I think cholesterol, I think I'm correct in saying that cholesterol has a part in producing all of our hormones. So it's pretty important. And I think one of the reasons that it is being considered now a conspiracy by the pharmaceutical companies, aside from the fact it's the #1 drug in the world, is that they're lowering the norms for cholesterol. When I got into practice years ago, the norm was 275 for cholesterol was considered normal. I'm not going to get into my opinions on that. Okay. But
try hard. You can
no, I'm not going to do it. I mean, but there are theories on cholesterol that don't make sense to me now. And over the years, I have watched it come down to 250 and 225 and then 200. And I'm going, this is like, I don't know. We're watching the chemistry. This is not making sense. And now we've morphed over into the point where some labs are saying that cholesterol should be below 150. My understanding from some of my mentors and colleagues is that if your cholesterol gets below 150, your brain and your hormones start to become challenged, particularly that hormones are difficult to make under 150. So this is some of the cloudiness that says, is there a financial motivation behind it, and so on and so forth. I just throwing that out there to kind of put that out there to let you know we're aware of that. Our goal here is to make the argument that whatever all that is, whichever side you're on, whatever you think, do cholesterol medications cause pain, numbness, tingling, burning, whatever the symptoms will go through, and in the legs or feet and or sometimes the hand? Do they cause peripheral neuropathy? So I think that kind of can be a segue into the medical model versus the alternative model.
Absolutely. And I want to iterate, and I think you framed that well. I want to iterate that it is really important you understand this, because from this, you'll understand the context of what we're going to discuss later relative to this issue of statins causing neuropathy, and the reason why it's maybe discussed in such a, it's just not a big deal manner regarding neuropathy and statin use. Because with the medical model, the general overview is that statins are so effective in decreasing risk of heart attacks, strokes, and vascular disease that any subtle side effects like peripheral neuropathy, which are not subtle in our opinion, especially when we see patients who have burning pain and they can't sleep and they can't walk and their legs are riding at night because they have neuropathic restless leg syndrome. It's not just a subtle side effect. So the medical model, kind of as we discussed, is that in essence, the liver produces cholesterol. Their opinion is that a lot of people are genetically prone to producing too much cholesterol, and these elevated cholesterol levels are bad for many individuals because it's going to result in them having an increased probability of all those things I mentioned, from heart disease to stroke to vascular disease. That's the medical model. So they're going to give you a statin medication to lower your cholesterol to hopefully improve your chances of living a long, healthy life without major adverse side effects. The alternative model is a little different because the alternative model deals largely with diet, it deals largely with anti-inflammatory diets, and many alternative practitioners, similar to ourselves, will test patients' cholesterol before and after putting them on an anti-inflammatory diet and see pretty significant reductions in cholesterol, which kind of goes against the whole notion that it's all genetic and that, you know, you're basically defined by your genes and you just got to get used to it and take your medications. The alternative model is also strengthened by this thing called a Jupiter study. And again, we're not going to get into it, but in essence, they'll oftentimes cite this, and there are some pretty intense statistics that get involved in studies such as this. But just know from a lay perspective that they did this study called the Jupiter study, where they took basically over 8,000 people with high cholesterol, put 8,000 on a statin, took another 8,000, didn't put them on a statin. 98.5% of those taking a statin medication did not have a heart attack, whereas 97.4% not taking the statin did not have a heart attack. So still a significant percentage, but in that, you know, 1.1, or what was it, 97.4, did I say 98.5 and 97.4? You know, within that 1.1%, there's a lot of statistics that get involved there, and there's a lot of controversy regarding that debate. But also know that the medical model, again, is not only saying statins are beneficial for heart attacks, but they're beneficial for strokes and other vascular disease. And because of that, that's why so many people need to be on them. Also know that from an alternative practitioner standpoint, looking at the average American may be thinking that they're eating in moderation, but oftentimes, not to be critical or judgmental, but the diet that the average American is eating is not necessarily congruent with the diet that we feel most people should be eating. So a lot of Americans may be having fast food a couple times a week. A lot of Americans are eating inflammatory meats, eating a lot of processed carbohydrates, a lot of fat, a lot of salt. And with those diets, basically they're a ticking time bomb, probability-wise, for having major events like coronary and cerebrovascular disease. Whereas the alternative model is when we put patients on our anti-inflammatory diets, we see some pretty staggering effects from those diets. People get healthy, people lose weight.
Just the diet alone.
Just the diet alone.
Relative
their lipid
to all the other things.
Numbers come down. Exactly. Yeah, not including all the other stuff we do with them. So we see the potential in our country's population really to get healthier. You know, we have these societal problems, and we've talked about it a gazillion times. 1/3 of the population is overweight, 1/3 of the population is obese by 2050. Thoughts are that 1/3 of the population will be diabetic. We have some major some looming issues with our healthcare, but that's kind of the broad spectrum.
Yeah, and the inflammatory model even goes further, because the inflammatory model, if it's extensive, if let's say we put the person on a diet and it doesn't change, things don't change, maybe they've got an immune response against their thyroid, which can alter cholesterol levels, or maybe they got a bad gut that is altering their liver's ability to work. And I mean, so the alternative model is certainly primarily an inflammatory model, but as you start to pull the string on that inflammatory model, the longer it's been there, the heavier the person, the more maybe they got diabetes and these other things. Now it becomes an issue where global chemistry can be involved, and HDLs can be upset, and cholesterol can be upset at the same time, and so on and so forth. So it's a fix the whole system, inflammatory system model versus take a drug for cholesterol. And just to put that in perspective, that Jupiter study, which I can never remember, so it only says that what it says in the end is a very small percentage of people benefit by taking the statin drugs over that period of time. It's the biggest study ever done, I think.
I don't know if it's the biggest, but it was a big one. I mean, that was a big sample size on both sides of the coin.
I mean, the percentage was what?
Well, that's where they get into number needed to treat statistics. And so in essence,
it came down a couple of percent.
Yeah, but the number needed to treat as well, basically how many people taking a statin medication need to take that statin medication to prevent a life-ending heart attack. And there's other just very complicated statistics where, people get into arguments about these issues. Yeah. And I'm not a statistician or a psychometrician, so.
Yeah, and those numbers they're subject to debate for sure. Yeah. But even those numbers that Dr. Gates reviewed are not something that would make you think, let's jump and take a statin drug right away, if there are other methods of going about that. So that was a heart study.
Right. And
We're
then the
going to
other,
get back to peripheral neuropathy.
one more thing, last thing I'll say on this is that if you have elevated cholesterol and your doctor doesn't put you on a statin, you can sue them for malpractice if you end up having a heart attack. So think how a doctor feels. So he's not necessarily going to trust you to go on this correct diet and lower your cholesterol levels. So, you know, push comes to shove, they're going to put you on a cholesterol therapy that is going to, you know, in their world, give you a probability of having a better life and, you know, protect themselves so they can sleep at night.
Because the standards of care have been influenced by the pharmaceutical community. I can say that from experience. I've attended a class in which I was the only non-medical personnel there and listened to a doctor who was, I'm told, being paid $10,000 an hour over the period of 2 hours to convince the medical community sitting there, the doctor sitting there, that that was what had to be done. And that if they didn't do it, it could be malpractice anyway. So so I'm sure all that leads to it being such a high sales item in the medical field. So let's go back to peripheral neuropathy now. That was our 5% of statins and the theories on heart versus taking statins versus not taking statins versus preventing heart attacks. Let's go over peripheral neuropathy for those who have never seen us. For those who have seen us and watched, you've heard this before. We have hours online on peripheral neuropathy. It's a big part of what we do. Again, Dr. Gates is producing a book. I'm collaborating slightly on it.
No, he's editing it back down into English.
And so let's just kind of go over peripheral neuropathy and causes of peripheral neuropathy and the term idiopathic neuropathy, which is what half of you out there have been told that you have, or more.
Exactly, which is really the bent why we're doing what we're doing, right? It's the reason for our approaching this problem. So neuropathy in this country, in essence, most individuals will go to their doctors, are told diabetes can be the cause half the time, and the other half the time, frequently, we don't know the cause. Either way, you're going to end up taking a medication for the peripheral neuropathy, and there's really no cure for the condition. We have gone to the literature, we have gone to our mentors, and our mentors trained us in a certain fashion, such that Dr. Rutherford was trained through functional medicine to get to the underlying cause of the illness, which may sound general, or why isn't modern medicine doing this? Again, modern medicine lots of times has to give you a drug to block a problem because getting to the cause of the problem may be more entailed and laborious than they have time to do as doctors. Your doctors aren't bad, it's the system is kind of set up this way. So let's say somebody has diabetes, and Dr. Rutherford's approach, as he learned it, was to get to the cause of the diabetes. And we're finding that the causes of diabetes, yes, there can be genetic components, but oftentimes through dietary interventions, a person's diabetes type 2 can be improved. We're also finding significant correlations between the gastrointestinal tract and diabetes. So you can actually go in and reculture the bacteria in the intestines and influence diabetes. Just a case in point. And then there's my side of the model as a chiropractic neurologist, which is to stimulate damaged nerves or damaged nerve cells back to life. And sometimes that can work and sometimes it can't. But oftentimes it works really well when you get to the underlying metabolic cause. So if you correct the diabetes and you start stimulating damaged nerve endings back to life, 5 years ago, coming up on 6 years ago, we started seeing some pretty dramatic changes. That's when Dr. Rutherford and I joined forces. So we started seeing patients with neuropathy who were told that they were left to deal with this illness for the rest of their lives, all of a sudden start to feel in their feet, their numbness and tingling was going away, their burning pain was going away. And we started scratching our heads saying, well, this is pretty cool and pretty interesting. And since then, we've dedicated a significant amount of time and energy crafting our techniques, crafting our protocols, crafting who we think is going to do well with our treatment approach and who is not going to basically come up with this model of approaching neuropathy. And that's the impetus for us writing this book.
Yeah, and the reason we think we can do that is because this model has developed consistently successful long-term results for properly selected patients.
Right.
I want to throw that last part.
Exactly.
In there. Okay.
Exactly.
So we see statins a lot.
And so then within that model, diabetes is half the cases of peripheral neuropathy. But then this other half, which is frequently told, we don't know what's wrong with you. Dr. Rutherford and I discussed in our neuropathy seminars, new insurance regulations that are coming down the pipe being imposed on doctors and especially neurologists, confining them to what they can and cannot test for. If you look at this other half of neuropathy patients that are not diabetic, there are literally about 79 causes as to why they have neuropathy. But insurance is trying to limit doctors down to testing for 2 of those 79 causes. So you can see that that may be a little frustrating for you as a patient if you want to really figure out what's going on with your condition. Now, within this 50%, statins are a component of them. So taking a statin medication can influence your risk for developing peripheral neuropathy. And it's discussed in literature, and we've seen it clinically, that basically removal of a statin medication, especially early on, can produce significant changes and improvements for the neuropathy sufferer. Now, we never take a patient off their medication. We work with the patient's doctor and explain to them, hey, this is what happened. We see these signs of neuropathy. Would you be willing to consider this other form of cholesterol lowering medication or dietary intervention in order to help this individual? So that's kind of the overview there.
Yeah, so basically, it's been thought for the peripheral neuropathy patient that since it's been shown that statin drugs ostensibly mainly attack the muscle tissue, causing a lot of muscle damage, something called myositis. They can get really severe and cause
rhabdomyolysis,
which I can't even say. That's his area. But we've seen it. We've seen it. And I thought for a long time, well, that's what was causing it. It was damaging the cell walls, or it was damaging the muscles, and so on and so forth. And we had patients who, after discussing in the consult that we do to evaluate who would be a proper candidate for this program, they would go home and stop their statin drug on their own. And I would say, I didn't tell you to do that. I didn't tell you to do that. Okay. I'm just telling you that statin drugs are associated in a certain percentage of times with this. And yours happened to start about the same time. You might want to go talk to your doctor about that. Some people don't go and talk to their doctor about it and do it. And then they would come back and say, wow, my peripheral neuropathy is a lot better. However, apparently, case reports about peripheral neuropathy being caused by statins started to surface in about 1995, as per Dr. Gates's research. And interestingly enough, ultimately, and it shouldn't be surprising, but ultimately, apparently, the statins also affect nerves. Mm-hmm. I think this is very important because I don't think most people are aware that this is the case, even though a lot will come in and say, man, I took this statin drug and my memory started getting bad and I couldn't think. And they had a lot of neurological brain signs, headaches and dizziness and stuff like that. But never even me. I'm thinking like, wow, what is that doing? It's like hitting the nerves. Is it hitting the muscles? And what's it doing? Is it causing muscular tension? As it turns out, it affects the nervous system in a certain percentage of cases. Mm-hmm.
And as you alluded to earlier, statins or cholesterol is a key component to many areas of our body, to the brain. The brain is basically fat, so cholesterol makes up a large percentage of what your brain cells are made of. Cholesterol also makes up a large percentage of your peripheral nerves. And more importantly, when people take statin medications, the statin medication is something called an HMG-CoA reductase inhibitor. You don't need to remember that. But just know that there's a biochemical series of events, many, many steps. 17 if I remember correctly, but I could be off on that. Biochemistry was a little while ago. There's a number of biochemical steps in order to get from point A to point B in making cholesterol. And along that series of biochemical steps is the production of something called coenzyme Q10. Coenzyme Q10, which many of you have heard of, is very important for a body's ability to make energy. So it's involved in this little energy factory in most of our cells called the mitochondria. And CoQ10 is also important for nerve function aside from that. So when people take statin medications, the thought process is that the statin decreases our CoQ10 concentration, decreases our nerves' ability to make energy, and thereby can have a toxic effect on the peripheral nerves. Now, this basically in 1995, I think it was the Journal of Neurology, Neurosurgery, and Psychiatry came out and started talking about patients who were on statin medications all of a sudden developing signs of peripheral neuropathy. And these authors were saying, well, what's going on? Well, and they found that if they stopped the statin use, that in essence, these patients got better. And if they put them back on a statin, then they felt worse. And I think even they saw that when they were off of the statin medication, that there were some signs of even permanent damage. So that was the first report of it, 1995, to the nerves. So then again, in the late 1990s, more cases started coming out, and they were seeing that not only were the big nerves affected that go into the lower extremities, the big nerves have big diameters, and they're involved with things like balance, sensing where your toes are at, feeling vibration in your feet, but also that statins could influence these small diameter nerves that are more involved with pain. So some patients may have a presentation where their feet burn, and other patients may just have a presentation where they can't feel anything in their feet. And then the landmark study came out in 2002, where this gentleman by the last name of Gates looked at these cases of neuropathy and which ones were taking statin medication. So idiopathic neuropathy, which ones were taking statin medications, which ones weren't. And he found that by taking a statin medication, your probability of developing peripheral neuropathy is about a 1,400% increased chance of developing it versus not taking a statin medication, which is along the lower estimates of developing lung cancer from smoking.
Now digest that just for a second. He said 1,400 times.
1,400%, yeah, or 14.2 times, yeah.
14.2 times, 1,400%.
Odds ratio of developing
That
neuropathy.
is something to chew on for those of you who are out there who maybe are taking a statin drug and your peripheral neuropathy maybe just started shortly after you started taking that medication. Or maybe you started getting headaches, maybe you started getting balance or dizziness, or maybe you started getting other types of symptoms that came out of nowhere, neurological symptoms at that point in time.
And so that study kind of had a splash through the literature, so to speak. And since then, in many cardiology journals, they have come out and they acknowledge the risk of taking a statin medication and its effects on neuropathy, but they'll say relatively, because so many people take statin medications, and neuropathy, though it's a common condition in our society, statin-induced neuropathies are not a huge percentage of the pie. They're a percentage, but they're not huge. That this is a relatively minuscule side effect.
But I think that's because they're not doing the, I would say, research, but they're not doing the examinations to tease that out as a probability to understand that this is what's causing that. This is the history. The person took it. This is what started. We do a neurological exam. He does the neurological exams. They have small fiber neuropathy. We send them to the doctor. The doctor says, okay, it makes sense. Let's bring them down. They bring them down. They get better. I mean, that doesn't happen. The percentage is probably much more significant than what they think.
Right, and they've even done studies, and I would have to go and dig this one up, but I remember reading one where they were discussing that with statin use, you may not even have peripheral neuropathy, but you just may have abnormal sensation in your feet. So there's almost like this subclinical neuropathy where the nerves have been damaged. Never would have even been thought.
So it wouldn't be in there in anybody who was assessing, okay, that's peripheral neuropathy, let's add that in.
Right. And then it's also talked about that many physicians are relatively unaware of this side effect of peripheral neuropathy being associated with statins. So many physicians, general practitioners, cardiologists are acutely in tune that statins can be associated with muscle pains or liver damage, rhabdomyolysis, as we've discussed, or even cognitive side effects like memory lapses. But the issue of neuropathy is just kind of coming to the surface, and they're trying to get the information out there. But again, they'll just say, due to the overwhelming positive attributes of taking statin medications, the side effect of neuropathy is rather inconsequential.
And not to keep throwing gasoline on the smoldering heart fire that I said we weren't going to talk about, but for our amateur nutritionists out there who come in and enlighten me every day on what they read on the internet, isn't CoQ10 a important factor in heart function?
It is absolutely. CoQ10,
kind of interesting.
Right.
Damages CoQ10 heart function. Just throwing that out there.
And we will do a broadcast on statins at some point where we present both sides of the issue, but
yeah,
that was a little more, we'll have to do some more research on that.
Yeah. So most studies are acknowledging that statins can cause peripheral neuropathy. you wanted to discuss, however, relative to now, part of the conspiracy theory is that now that people are starting to have massive controversy about statins maybe not doing what they said they're doing and maybe just being a big moneymaker, that now the scope of what statins can do is being expanded. And one of the areas that it's being expanded into is it's being called an anti-inflammatory.
Right.
And you wanted to address
absolutely,
that.
Absolutely. Because again, we wanted to approach both sides of this issue so that
Be fair.
Exactly. We got to be fair so you as the patient out there can make an informed decision rather than us just saying statins are bad. Relative to diabetic peripheral neuropathy, as an example, statins are being shown not only to lower cholesterol and perhaps increase blood flow in an artery because of taking cholesterol out of that artery, but they're also being shown to dilate arteries, which is kind of interesting because one of the critical factors in diabetic neuropathy is that the blood vessel to the nerve starts to close down. And the statin is being shown to vasodilate that artery, very similar to taking a nitrous pill if you have angina. So that's interesting. Also, as Dr. Rutherford alluded to, statins are being demonstrated to have this anti-inflammatory immune component to them, such that they're now being hypothesized to help conditions such as multiple sclerosis. They're even talking about them for other autoimmune disorders. And even conditions such as Parkinson's disease, they're theorizing that statins can have these quote unquote neuroprotective effects. So there are some positive associations with statin use as well. There are negative associations. I think our whole point of today's broadcast is really to bring it into view that if you have idiopathic peripheral neuropathy, and if you're taking a statin medication, you may need to look at when you started the statin medication and when your neuropathy symptoms developed. And maybe you need to discuss that with your doctor or your neurologist, or you need to get a consultation from someone who's pretty trained in dealing with neuropathy so that you can get a kind of a solid opinion on that.
It does feel to me, doing the interviews, doing the intakes and doing the histories and the exams, that more doctors are becoming aware of that. I'm hearing more frequently in the last couple of years than before. My doctor already helped me and we talked about it, and I had the side effects and he took me off the Q10. Normally in a allopathic clinical environment, a medical clinical environment, it's a symptomatic type of a situation in which you go back to the doctor and say, I'm experiencing this, I'm experiencing that, I'm experiencing this, headache, numbness and tingling in my feet, so on and so forth. And more doctors, instead of saying, no, that couldn't be, more and more doctors are cooperating and saying, okay, let's cut it down in half and see what happens. Again, there's that background of the minimum standard of care in society today is high cholesterol, you get a statin drug. You've had a heart attack, you get a statin drug. And because medical societies have been influenced to help set the standards for malpractice, saying if that happens and you don't give them that drug and that person has another heart attack, then you can get sued. So that's the reality of it. We're not being critical or judgmental or whatever. We're just giving you the data as to what your doctors have to do and how they have to. I was trying to put my hands behind my back, show that they're working halfway behind their hands with their hands tied behind their back today in so many different ways. And this is one of them when it comes to statin drug prescriptions and in the management of getting you off of it. Most of them will take you off of it slowly, which is fine. But it is much better today than it was. Now, what much better does that mean? 5% do it when none did it, or 25 or 30? I don't know. All I know is I'm hearing more and more that doctors are becoming involved in cooperative in lowering it if the symptoms make sense relative to the timeliness of the symptoms coming on, relative to their starting you on a statin drug. So there's a lot of, I mean, the big aha for me ultimately was that these medications damage nerve tissue. And it had been originally that they damaged muscular tissue, not a small development. And so it's been acknowledged in the literature that more and more that statins are causing peripheral neuropathy, that they are causing nerve damage. Dr. Gates just gave you kind of an allopathic approach to getting better. What would you do? What would we do, kind of quote unquote alternatively for what would they do? Would they take something natural? Were you planning on going through kind of a little bit of what we have found as to why we have kind of put these two professions together? You alluded to it in the beginning, but that was kind of before they had the data.
Right. So frequently in these situations, if we do have a case where somebody's taking a statin, they do have hard signs of neuropathy, I will write a letter to their cardiologist explaining the situation. We've had wonderful experiences working with cardiologists in our hometown here, and in fact abroad as well, because we have patients who fly in because of these videos and get evaluated. But in writing these letters, we'll say, this is what's going on. Would you consider an alternative option for treating the cholesterol? There are other medications that lower cholesterol, just so you know, they're not statin medications. And we will use dietary interventions while monitoring the individual's cholesterol. And you can supplement with CoQ10. And CoQ10 is, I attached a journal article where CoQ10 has been shown to improve a lot of these symptoms due to statin use when people have side effects from the statin. And they've also done studies with intervening with CoQ10 and found that individuals didn't seem to have long-term events such as heart attacks and things of that nature with the use of the CoQ10, because it seems to be cardioprotective. So we'll do kind of a trial like that and see where the patient is at. And frequently we'll see that the cholesterol goes down, the cardiologist is happy, they're willing to do this trial. And in that time period, we go and we basically use neuromodulation, which is a fancy word, which is, think of a heart, you shock it back into life when somebody's having a heart attack. That's what we try to do with the nerves. And if we see signs that it's going to work, then we'll do that on a consistent basis with the patient. And through that, and getting to the underlying metabolic cause, in this case, potentially a statin medication, we've seen some significant improvements. So that would be our approach.
Yeah, we've seen significant improvements. We've seen people get better.
Yes.
Yeah. Yeah. So, and again, not to make it simplistic, okay, because that is a core. A lot of times I seem to have a particularly high number of people who came in the last week or two who pretty much are coming in and digging for basic data. I kind of can get with the understanding that they felt that they could go home and probably do this on their own. And there are certain cases in which that can happen. But again, understand, by the time your nerves have become damaged, by the time you may have GI symptoms from this, from it affecting your gut and causing all kinds of almost irritable bowel-like syndromes. You can have headaches, and you can have memory loss and all these types of things. There can be much wider number of etiologies, of causes, if you will, that exceed what the basics of what we're talking about here. If you try these, if you take the CoQ10, if you go to your doctor and he helps you to get down off your statin drugs and your feet still hurt, it's because those nerve endings have been damaged and they're going to need help to come back. If you are on an anti-inflammatory diet, you've taken a CoQ10 and you've brought down your statins, there are other things going on. Other systems have been damaged that are not allowing the inflammation to go completely away. Other systems have been damaged that are not allowing the neuromodulation, the kind of stimulating, the defibrillating of your nerves down there to heal them, are not going away. So it probably will require a little bit more of a sophisticated workup at that point in time. And frankly, that's more oftentimes than not the case. So just to let you know, we're giving you the basics of the fact that there is data out there coming out literally, regularly. I won't say weekly, but regularly now, that is starting to bring light to the controversy. Yes, it does help this. No, it doesn't help that. The statistics are gray in this area. The statistics are clearing up in this area. So it's still an evolving process. And so we're just trying to bring you the basics of trying to clear that controversy. I've had patients that come in here and they're like, my doctor told me to take a statin drug and I'm not going to take it. And I'm not necessarily against that if they're sitting in front of me looking for another alternative. And again, the medical model is based up against the fact that they're only looking at their medical model. They're not saying, like we'll say, okay, you can do this, or you can go take a statin drug, see how that works. And if that ain't working, come back and do this. But the medical model is do this. There is nothing else. Okay, which is not true. And so we're trying to give you that perspective too.
Mm-hmm.
So statin drugs do cause peripheral neuropathy. What percentage of the time is difficult to tell, but the studies back up what we are seeing clinically in our office, daily and weekly. What would you like to add to that?
I don't think anything. I think we pretty well covered the issue.
Okay.
Yeah.
So that's it for this week. Do statins cause peripheral neuropathy? Yes. Do they cause all peripheral neuropathies? No. Do everybody taking a statin who's got foot pain have statin cause peripheral neuropathy? Not necessarily. You really need to be evaluated and find out what it is that's causing that small fiber neuropathy. Hopefully, this has been a good presentation to kind of give you an idea of the controversies out there and why they're there and where those controversies seem to be going. But in the end, we want to thank you for tuning in again this week. And for those of you who've come in first time, welcome. If you have any suggestions for topics or anything like that, please let us know. We have a couple of months ago had to start to decline answering questions. It was taking hours a week away from time. We take this time out of our daily patient treatment and patient preparation time to do this. So, and we kind of limit our practice to a certain number of patients per month. So we know that we're doing a good job. And so doing 2 or 3 or 4 hours a week of answering those questions was becoming a little bit challenging for Dr. Gates because he was the one who was doing it. So thank you for your interest. We will attempt to come up with another interesting topic next week. And until then.
Thank you for watching.
Yeah.
Yeah, we'll see you next time.